Good afternoon, everyone. Welcome to our second Returning to Work at COVID-19 Level 3 webinar. We have with us today Chris Alderson from Construction Health and Safety New Zealand. We also have Graham Burke, Specialist Trade Contractors Federation President, and also joining them is Colin Smith from Electrical Works. They will give us a bit of an update, and then we'll go through our question and answer session. If you have a question that you have not already put forward, down the bottom of the screen you will see a Q&A button where you can type in your question, and I'll go through those with the panelists in a little bit. So I hand over to you, Chris, and you can give us a bit of an update.
Yeah, good afternoon, everybody. Pleased to be back again. Look, there has been a few things sort of moving around over the last couple of days. What I was going to do is just share my screen briefly with you all to show you where you can get in this information, because I know a lot of the questions that have come through are, where do I refer to that? So the first thing I'll do really is just share my screen back to the CHASNZ website, which hopefully, can you see that, Graham? Give me a thumbs up if you can. Yep, you can, great. So I'm assuming everybody can. So look, as things are updating, we're trying as much as possible to have the CHASNZ.org COVID-19 page as your sort of one-stop shop for you. You'll see that right on the sort of banner here that one of the latest updates we've had, which was from yesterday, was the fact that the government have sort of clarified that yes, businesses can re-enter their sites this week in preparation for COVID-19. So I guess that's one of the things that the Prime Minister mentioned earlier in the week, and everyone sort of stood up and took notice of and said, well, what does that mean? On here, there's actually a link to a document that is a Ministry of Health document. So this is an amendment to the restriction orders, and if you go down there and have a look at that, it says, look, the closure of premises does not prevent any person from accessing any premise for the purposes of carrying out necessary work between essentially the 21st of April and 11:59 p.m. on the 27th of April, given that the 28th of April is when we come out under lockdown level 4 and we transitioned into level 3. They've further defined necessary work as work required to prepare the premises for opening and meet public health guidance, which includes the guidance and the protocols that we've talked to you about before, as well as minimum basic operations required to maintain the condition, value, or cleaning of the premises, plant, equipment, or goods, care for So look, we don't have any more information or advice really other than that statement to give you. Our interpretation, and I guess the industry's interpretation is, look, that will allow us to go there and essentially look at how we actually might implement the protocols in terms of hygiene stations, making sure that the site's fit for purpose, that there aren't any other risks that have come into place, and do a little bit of sort of checking and making sure that we're good. What I think it doesn't mean is that we can go out there and do sort of wholesale work, which like erecting or de-rigging scaffolding or moving walls around and stuff like that, which actually would require the protocols to be in place in the first place, and definitely no high risk work like you'd normally need a permit to work for, say for example a confined space entry or something like that, because we don't want to raise the risk. So I guess that's the first thing. That's good news, because I think it does give us some opportunity just to make sure that our sites are okay and that we're ready. And I guess the message there though is, look, just be sensible in what you do there, and there's the reference to the document there if you need it. Again, just running down the site there, the standard, which I've talked about before, the standard is that statement of intent for organisations, that what they have to achieve. That's the document that has been endorsed by WorkSafe. And WorkSafe have subsequently been putting some stuff on their website. They've come out with some positions that says, yes, obviously, as in our protocols, you do need a site plan. They've actually got a really good, really simple template for a site plan, which I'd encourage you to have a look at if you haven't already started. One of the questions that had come up from last week's announcement by the PM was she'd mentioned sort of self-assessment and auditing of businesses. I can confirm that there's no intention to have a registration process within construction. What MB and WorkSafe's position is that, look, WorkSafe are the compliance arm of the COVID-19 response. They will have inspectors out there. They will be randomly auditing sites. The first thing they'll probably ask for is something like, you know, where's your COVID-19 plan, and show me how you're actually applying it on site. There's no requirement to submit that plan to WorkSafe, though. It's very much along the spirit of this whole fight against COVID-19, which is about unite. You know, we've all got to unite and do the right thing. And even with the best will in the world, obviously, WorkSafe playing their role, you know, will be pretty thinly stretched across all of businesses to go out there and do that. So we're really relying on organisations to be standing up and making sure that they get this, that just as we have as public during lockdown 4, that we're all sort of joining together to make sure that we get on top of this thing as soon as possible. Just mention another couple of things there, the vertical and horizontal protocols. We have had some updates to it. The biggest update that we had was around this 2 metre versus 1 metre rule, which I know has created a lot of discussion. We don't intentionally want to create this sort of uncertainty out there, and we are resistant to actually changing the protocols. However, the Prime Minister and government again announced last week that the minimum requirement for a business environment would be 1 metre, so dropping it from 2 metres, which was the previous public advice. We went back and queried, you know, just asked for some clarification on that. WorkSafe have actually come back and clarified their position, which is government's position, is that in the workplace, 1 metre as a minimum is appropriate based on World Health Organization advice. The World Health Organization also dropped their physical distancing down to 1 metre last week. And given the fact that while 2 metres in public is still appropriate, given the fact that we can't contact trace people, it's very difficult to trace people in the public environment. In a workplace or in an education facility, it's a lot easier to contact trace people because you know that we're all tracking and tracing on there. So that's why there was a scale down to 1 metre. Having said that, the 1 metre is a hard stop, so you can't go below 1 metre under alert level 3. We understand that there just will be some work that will be very hard, if not impossible, to undertake. Alert level 3 is still limp home mode, so we're not up at full operations. So we're not expecting that even with the additional controls, you'll be able to work below 1 metre. One question that's come up around 1 metre is, does this mean that 2 people who are 2.5 metres apart and then they reach their arms out, that might be less than 1 metre between those 2 outstretched arms? Does that count? And I think, like, our advice is, look, it's about your body core, it's about shoulder to shoulder type stuff. So we know that obviously, you know, if it was 1 metre between people with outstretched arms, that would affect like a lot of pipe fitting and other work. So it's just that pragmatic response. It's about 1 metre between your core. In terms of public transport or private transport, this will mean that you know, you won't be able to sit shoulder to shoulder in a small car, obviously, because that would breach the 1 metre, but you could have one in the front right and one in the back left seat and still be 1 metre apart. So I was thinking about that practically as well, and it's all about risk mitigation at the end of the day. And this is one that has come down from government and really just been mandated to all businesses, not just construction. So it is a 1 metre hard floor on that. So that's probably the major change in there. There is some other stuff coming out pretty soon for foreign language. So there's a residential protocol in Mandarin that the guys have worked on, which is great. And we're getting some feedback that some of the other languages we might have to cover as well, like Filipino, Korean. And again, like, it's all, look, there's people that have to work on this. Just we will hopefully get some stuff out, but it's all taking some effort behind it. The other thing that we've dropped on here, which I think is really important for everyone to note, is our sister organisation, Mates in Construction. I'm also the chair of Mates in New Zealand, and they've done a really good job in putting together some toolkits for business owners and individuals to work through from a mental health perspective. We know that mental health in the construction industry has always been an issue. It's probably going to get exacerbated now. We have the highest suicide rates of any industry in New Zealand. What they've done in this link here will take you directly to their website, mates.net.nz, if you want to go there directly yourselves. They've got a really good resource on there, which is a guide for managers and also an induction kit around mental health issues as well. So particularly, and it's a really simple stuff in sort of plain language, because I know that most of us aren't really au fait with talking to our staff about some of these things, but I think they've done a really good job to make it as simple as they can. So those are some of the major changes. Again, all this is available on COVID-19, CHASNZ.org COVID-19. We have seen WorkSafe come out with their overarching website throughout the week. I can reassure you that all the WorkSafe material is consistent with what we've got in our standard and our protocols. So the WorkSafe material anticipates that there will be additional guidance from industry. We've worked with them right from the start to make sure that we're lined up there. So we're in good stead from that perspective. And they have put some useful tools as well, some useful additional tools on their website that I think will be quite valuable. So Graham, I might stop there, and then I know that there were some questions in particular that we might want to work through for the rest of the time, or some other questions that might come up through the rest of this webinar.
Thanks so much, Chris. So we do have some pre-prepared questions that have been sent through to us. We'll go through some of these, and then those of you that are asking questions today, we will endeavour to get to those questions for you as well. So to start off with, I have just received notification to attend a pre-start contractors meeting on Friday to discuss a restart for my team on site for Tuesday 28th. I have no intention of attending this meeting and no intention of restarting on the site until level 2. What are my obligations?
Hi guys, I'll take this one. I would say you're probably under no obligation to actually go back to work, but the best thing you could do there is to have a discussion with your client and that communication around it. Now, if you've got people at home that are vulnerable, then you've got a very good case to say that we should not be coming back or doing those meetings. But in reality, if you take all the health and safety factors into consideration, you probably will be okay. But again, I'd just reiterate that the communication with the client on that, and if you've got concerns, just have a discussion with them about it and see where it lands.
I think thanks, Colin. I'd back that up as well and say that, you know, talking about it's expected. I mean, it's been quite normal for people working under level 4 for people to be very unsure about whether they wanted to turn up for work or not. And I think it's about the organisation as well providing the confidence that they have got a plan in place, that they are following the protocols, that they are driving the risk down, you know, in a structured way. Because that response I can totally understand, and there'll be thousands of people all over New Zealand thinking the same thing. They've just been in their bubbles for the last 4 weeks, and now they're going back into the world and what's going to happen to them and their families. So I think, look, one of the reasons we put these protocols in place was not just to get people out there and working, but it's to get confidence back for people who might be in a similar situation with similar questions, that we can actually work safely. I think the good thing about these protocols is they've all been looked at by, you know, the University of Auckland School of Public Health epidemiologists, and they're good, and they've stood up to a lot of scrutiny. So the last thing I'd sort of add is there's probably not going to be too much difference between level 2 and level 3 from an operations point of view. So from the things we're going to have to do, it'll probably be very similar. Just under level 2, we'll probably see more businesses coming back to work.
Just a word of caution, depending on what contract you're working under, if you are legally able to go back to work but you refuse, you may be subject to penalty clauses. So I'm not saying you would be or wouldn't be, but I think that's something that you'd need to consider. Certainly if you're being asked to go back to a site that hasn't met the protocols, you've got you shouldn't be going back to work. Likewise, if you can't actually show that you meet the protocols, then whoever it is that you're contracting to shouldn't be allowing you to come back to work. But if all those protocols are being met, then you would need to take into consideration your contractual obligations as well as your health, which obviously aren't as high a test as the health and safety requirements. But if they're all able to be met, then I think those contractual responsibilities would stand.
Fantastic, thank you guys. So that does actually lead us into some questions around PPE. The first being, do we need to wear a mask and gloves on commercial construction sites?
Look, through the protocols, and we've been very clear from the beginning here, the answer is no, not unless you were wearing one beforehand for other reasons, like for dust or whatever. So the reasoning behind this is that wearing particularly the most commonly available masks, which are the cloth the normal sort of paper masks, not the N95s, isn't a good defence against COVID-19. And the reason for that is because you actually touch your face, you actually put them on, you put them off, and they don't actually filter the virus out very effectively. Where they have been advocated overseas, particularly by the WHO, has been in countries and businesses and in public transport where there's been large populations and a lot of community transmission. So places like Europe and some parts of Asia. And in those situations, it has been very effective in actually stopping the infected people spraying droplets everywhere. So we're not in that situation in New Zealand. We've got almost no community transmission, and it's just not a practical or effective defence against COVID-19 to have construction workers wearing masks. The N95s, the slightly more complex ones, require training. They require face fitting. You can't have any face fuzz like I've got on there. And even then, they're not foolproof because we do know that health workers get infected as well. So look, masks, we don't want to go out there and have everybody charging around trying to find masks. That also pulls them away from the people who really need them, which is the health workers. And there is always going to be an inventory and stock issue that we're trying to manage in New Zealand going forward. So as an industry, the advice is unless you need them for other reasons, then it's not a requirement, and that's a strong recommendation. We do know that some sites have gone out there and probably put on belt and braces and a whole lot of stuff, but look, at the end of the day, that's not the recommendation.
That leads nicely into another one around PPE. Someone has had a number of site principals who have put in place mandatory PPE requirements that are above and beyond what the protocols are suggesting. In some cases, they're unnecessary and impractical. And some actually go directly to advice from the standards. So it sounds like this person has been trying to engage with these companies, but unsuccessfully. How would they encourage the companies to align their systems with those of the industry when we've already raised the issue with them?
Well, I think there's a couple of places you can probably go in, like associations like yours, Graham, can probably provide some support. Master builders, registered builders, master electricians, going back to their associations for a little bit of help to start off with, to actually try and get some support in that conversation for those organisations if it's happening. We know that CHASNZ, for example, have been playing that role as well, just trying to get the word out there and working with their constituents. So that would be my advice, Graham and Colin. I think, first of all, just go back to your associations and ask for that support. That's what they're there for.
Yeah, and I think you might also find that as there's more information coming out, those companies that are running those sites may well have a bit more of an overview of what is actually required, and so they'll be possibly backing up on the on where they'd landed with the health and safety requirements early on in the piece.
Yeah, there is also a requirement under Health and Safety at Work Act, which is still the overriding act, that the person in charge of the site does need to engage with their workers and other PCBUs on site, which includes subcontractors and clients. So we should actually be working out these controls together so that they work for everybody.
Agreed.
Okay. So we've had a few questions around scaffolding. The first being, do we need to disinfect scaffolding on new builds?
Graham, shall we get you to answer that one? Your passion.
Look, my understanding is that high touch areas are the areas that need to be disinfected daily, and so my recommendation there would be the guardrails on stairs, gates at access points, ladders, any area that multiple people are touching as they move through the scaffold. Once again, you know, we're meant to be using the hierarchy of controls, so WorkSafe and the protocols that we've got on the CHASNZ site suggest where possible you have a one-way system for workers moving around scaffolds and other restricted areas, so that you're actually reducing those contact distances and the amount of surfaces that you're going to be touching. But I haven't seen anything written that the whole scaffold should be disinfected. I don't think it would be a practicable step by any stretch.
I don't know how you do it.
Yeah.
Actually, the next one on scaffolding does kind of lead into that. My work is mostly residential and scaffold is on site for short periods. Is there a requirement to decontaminate scaffolding components as gear is moved between sites?
I think if you go back to what Graham said around, you know, those common touch points, I guess when you're taking down scaffolding, though, Graham, I defer to you here, you are actually touching a lot more of it, aren't you, when you're putting it in the back of the truck? So
yeah, look, I was hoping you'd answer it, Chris, because I've given it quite a bit of thought and it's pretty hard to answer. I think realistically, if you look at a scaffold, you know, if you've got a scaffold wrapped right around a residential property, you're going to struggle to disinfect every bit of the gear. I think at the end of the day, we need to do a risk assessment and take reasonably practical steps. So if you're looking at a standard kind of scaffold that would be erected and dismantled by a scaffolder over a period of days, then we would go back to what we said before and only those common touch points. Perhaps if you're looking at a different type of scaffold, a modular type scaffold, either a minor mobile like Colin's guys might use, or even an aluminium scaffold that tradesmen are pulling down themselves, it might be realistic in those circumstances to give it a wipe down if multiple people are going to be using it. But I think we need to just treat it like to a large extent like any other risk. And actually do an analysis on it and treat it appropriately.
And I think also if you did find that there was somebody who had been tested positive on your site, then you're going to do a major decontamination of everything anyway. So you've got to be practical about it. And the other thing is, I suppose, when we've got the scaffold down, it's going to sit on the back of a truck for maybe 2 or 3 days, and theoretically the virus should have died off by the time it gets put back up next time.
Yep, that's true.
What about employees that have been confirmed with COVID-19? Is there any additional clearance required from, say, their local DHB once they've gone through their self-isolation period?
So I think this comes back to the Ministry of Health requirements. So my understanding is when this has happened, and it has happened, on some sites or under 4, that it's been pretty much managed by the Ministry of Health in combination with the DHB. So they take a lot of control on that situation and will guide people through what the appropriate process is for letting that person back. Just because in 2 weeks may or may not be the case, it's really their clearance, because I know that, you know, you get some people who have an ongoing sort of symptoms that go beyond that. So two weeks is definitely not a hard and fast rule. needs to come with the appropriate medical advice.
Do we have an SOP for cleaning vehicles?
I think in the protocols there's guidelines that look, it's obviously the high touch points. So, you know, where people grab handles, you know, controls, and it's really just about, you know, wiping down those sort of surfaces, plastic or metal. So there isn't a specific protocol there. It's more just, look, you know, give it a good wipe out, particularly if you've got, you know, different passengers actually travelling in it every day as well.
In the vertical and civil protocols, there's quite a bit of information in there. There's a couple of appendixes. One of them a cleaning appendix, which mentions vehicles and some other, actually some other points as well as cleaning. And there's also an appendix in there about getting to and from work, which covers a lot of these issues.
Yeah, thanks, Grant.
What if you have a worker who will not comply with the procedures?
So the Health and Safety Act 2015 hasn't gone away, and it covers the situation just like any other. So if you've got a health and safety, a worker who is not following reasonable instructions, then that person, there's actually, you know, I'd just get straight on to WorkSafe. Or, you know, if you're not dealing with it from a disciplinary point of view, and if you need some extra support, you know, WorkSafe are there to actually support you in this area, and that goes vice versa with your employer. So, you know, all those provisions under the Health and Safety at Work Act around whistleblowing and what the regulator can do in these situations haven't gone away, and they're probably there even stronger over the next couple of months because of this situation.
Yeah, once again, the protocols both really strong, strongly worded that they suggest a zero tolerance attitude be taken. You know, we as a country and individuals, we've gone through so much to get to this point. Let's not blow it by a few selfish individuals doing the wrong thing.
Agreed.
One question that has come in through today, would my health and safety consultant be seen as an essential service provider, and should I allow her to visit me pre-startup on my site to ensure all COVID considerations have been addressed?
So I think the concept of essential service, essential work, kind of goes away under 3. So, I mean, the advice generally is if they don't have to be on site, don't have people on site. However, I get the nature of the question is, look, I might need a bit of advice from somebody who can help me through my setup, and I think it's a good idea. My only challenge would be making sure that person has got the right knowledge, you know, around occupational hygiene. You know, having a bit of nous around that would be really good. So just maybe a few questions about their experience around, you know, particular about occupational hygiene and, you know, dealing with health matters like this on the workplace. So I think that would really stand them in good stead.
Yeah, once again, if they decide they are necessary to be on site, there are those protocols there on both the residential and the commercial protocols that cover off visitors. Yeah,
we have unfortunately in the last couple of days seen sort of a few less scrupulous sort of health and safety professionals sort of offering to do people's health and safety COVID-19 plans for $200 or $300. Our sort of advice would be, look, this really needs to be something that's considered by the business itself, and you need to really think seriously about it. You can't just it's not a cut and paste from somewhere. Look, there's a great template with WorkSafe. The protocols are great guidance that'll walk you through this. It's all totally doable.
Mm-hmm. We have time for just one more question. There is a suggestion in the protocols that minimum numbers of tradespeople are allowed on site. Surely that would need to be specific.
I think the concept here is that, you know, to allow physical distancing, and it totally depends on the size of the site, obviously, that limiting the number of people on site to those who just have to be on site is your first step. So making sure that everyone who is on there needs to be on there. And then secondly, if you're finding your site's getting to the point where it's getting crowded and you can't maintain that physical distancing, then think about, you know, scheduling and shifting and timing and prioritising the work to make sure that you can actually just have a bit more space and a bit more distancing between people on a pragmatic basis. So, you know, we can't sit there and say X number of people, you know, on this kind of site, because it really depends on the layout of the site and you know, the space you've got and the work you're doing.
Thank you very much, gentlemen, for all of your input today. That's all we have time for. I want to say thank you very much to our panelists, Chris from Construction at Health and Safety New Zealand, especially for your updates, Graham Burke, Specialist Trade Contractors Federation, and Colin Smith, Electrical Works. And thank you to Master Electricians who have provided the hosting for this webinar. Enjoy the rest of your day.
Thanks, everyone.
Thank you.
Thank you.